everyone. Good evening, guys. Hi. Good evening. Am I audible, guys? Am I audible? Hello. Hi, Rasi. Okay. Hi, Gauri. Hi, Sri Jaya. Okay. So, in yesterday class, almost we discussed some ICD questions, right? So let us check another ICD also. Okay, some important ICD sessions. Most of the students have, have difficulty to solve ICD areas. Actually, CPT is also important. 80% of CPT questions are asking in a CPC examination, and also same time ICD is also important. Okay, so let's get solve some ICD question. Hi Jidin. Hi Mohini. So already we discussed, I think, 19 questions in the yesterday. Okay. So let us check the 20th one. Okay, 20th one, question number 20. So guys, solve this 20th one. Namaskaram, Akash. Okay. What is the question? Patient present with fatigue, difficulty sleeping, and experiencing muscle tenderness for about 3 to 4 months. She states she is not depressed, has not had a fever, and just does not feel well. Labs are ordered TSH, T3, T4, CBC, electrolytes, and SED rate. So what SED rate? Okay, so what are the appropriate ICD tensium codes? Very good, Akash. But Akash, A4M 79.7, right? What about D? Just check the D option also. Sorry, C option, CC. Patient present with hospital, some, patient present with fatigue is there, difficulty sleeping is there, experiencing muscle tenderness. Oh, this is the, this is the main procedures, main, diagnosis, not a procedure, main diagnosis patient feel, right? So what will be the answer? Just check your code. Patient present with fatigue is there, difficulty sleeping, experience muscle tenderness, everything is there. Check your code and send me the correct answer. Those are symptoms, but here no diagnosis are mentioned here. Diagnosis are not present in a question. What will be no, what will be the answer? Diagnosis are, yeah, Mohini, correct answer. C is the correct answer. Diagnosis are not mentioned in your question. You have to take the symptoms. Okay. No diagnosis are mentioned here. Any diagnosis, no. No one. Actually, all these fatigue, difficulty sleeping, experience muscle tenderness, everything is a symptoms are mentioned in our question. There will be no diagnosis are mentioned. So diagnosis are not mentioned in your question. You can take the symptoms code. Okay. So option C is the correct answer. Okay. Option C is the correct answer for this question. Mohini, correct answer, dear. Akash got it. Everyone got it. Jitin got it. Let us solve 21. Okay, 21. 21. A patient is diagnosed with acute bleeding gastritis. What is are the appropriate ICD-10 code? Patient is diagnosed with the acute bleeding gastritis. So what will be the appropriate code for this encounter? Yeah, Akash, very good. Correct answer, dear. Option A is the correct answer. Very good. K29.01 is the appropriate diagnosis code. Okay, 21A. A option A is the correct answer. Mohini, correct answer, dear. Option A. Okay, yes. Next one, 22. 22. Yeah. Solve this 22 question number. Laparoscopy is performed for a patient with recent spontaneous abortion at 60 weeks. She is experiencing fever and pelvic pain. She is diagnosed with incomplete AB and retained POC. So, what is the appropriate ICD-10 code? No, Akash, yeah, 22. Rasna, just to check your code, dear. No, no, Akash, actually, D is also wrong answer. Okay, I will explain this question. Actually, here option D is the correct answer, dear, because 003.0 week of gestation should be reported only for those who are pregnant. Here it is says abortion was happened recently, right? So no need to report the weeks of gestation and treatment is provided for the complication. Hence the answer is B. Clear. Any doubts, guys? In this question, weeks of gestation should be reported. No, weeks of gestation should be reported only for those who are pregnant. Okay, so here it says abortion was happened recently because the recent spontaneous abortion. Yeah, right. So now need to report the week of gestation and treatment is provided for the complication. So that is why option B is the correct answer. Okay, got it. Yeah, just note it in your textbook. Okay. So option B, second one is the correct answer. 23. 23, a 30-year-old is seen at 28 weeks of 2 days of her pregnancy. This is her first pregnancy and she is having no complications. So what are the appropriate ICD 10 code? Devishri, um, check the code here. Actually, here pregnancy is mentioned here. So why do you want a code for Z 34.03? Four series of, I mean, pregnancy related chapters you have to code for most priority in pregnancy, right? You have to code for O series. That is our guideline. Devishri, why did you take option A, dear? That is wrong. Yeah, Agash, correct answer. D is the correct answer. Pregnancy is mentioned in your question. You have to take appropriate O series of code first. Okay. Yeah, Devi, D is the correct answer, dear. Okay. D is the correct answer. Okay, so Agash, correct answer. D is the correct answer. 009.513 is a 3A.28. Is it 38.28? 28 is a common option. Like it is for 28 week of gestation, right? That is correct answer. So you have to check only the primary code. Okay. Mohini, correct answer. Geedu, hi Geedu. I think it's a new student. Correct answer, dear. Option D, correct answer. Mohini, correct answer. Akash, correct. Okay. Devi also correct. Okay. So, yeah, let's solve 24th one. 24. A patient is seen in by infectious disease specialist is in consultation in the hospital. He was admitted with a pneumonia and his culture has indicated it is due to Klebsiella pneumoniae. So that is the, it's a diagnosis. What is the appropriate ICD-10 code for this? Okay, dear, confused. Okay. No need to confuse it, dear. No need any confusion. Actually, pregnancy related chapter. Any pregnancy is mentioned in your question. Have to take O series of code. Appropriate O series of code, dear. Okay. Because most priority than other chapter is pregnancy. Okay. 24th. Kidu, what about this question 24? Check the code, dear. Check the code. Is it B? Yeah, Akash, correct answer. Uh, Correct answer. D is the correct answer. J 15.0. Can you just check the code, dear? J 15.0 is the correct answer. Yeah, correct, Gauri. Correct answer, dear. Okay, D is the correct answer. Yeah, Mohini also correct, dear. D is the correct answer. Very good. Okay, let's do 25th one. 25. A patient present for a screening mammogram. She has no complaints. What is the appropriate ICD-10 code? Sorry, is it C? Carefully check the code. Is it D? Check the code, guys. Yeah, Akash, correct answer. Very good, dear. Option A is the correct answer, guys. Everyone just check the code. Is it 12.31? Is it 12.31 is the correct answer. Okay. What is it 12.31? Is it 12.31? Uh, yeah, code it is for a. Encounter for screening mammogram for malignant neoplasm of breast. Ah, that is correct answer because here also present patient present for screening mammogram. Mammogram. So that is encounter for screening mammogram. That is correct. For malignant neoplasm breast. Ah, because mammogram is performed for malignant neoplasm of breast cancer, right? So option A is the correct answer. Yeah, Gauri. Okay. It is actually very easy, dear. Easy to find. Okay. Everyone, please check it out. Rasna also. Okay. So 25, A is the correct answer. 26. An infant with cleft lip and hard palate is seen brought in by his parents to discuss surgical planning. What are the appropriate ICD 10 code? Mahesh? Mm, no. Actually, check the code. Cleft lip and hard palate is there any combined code for cleft lip and hard palate? No, Rasna. 25. 25C. No, actually 25A is the answer. Akash, wait. This is the 26th question, right? So 26D correct answer. 26D correct answer. Akash, I think your no question number was changed. You mean 26, right? Yeah, yes. Mohini, check the code here. D is the correct answer. Q37.1. Q37.1 is the correct answer. Just check the codes. Ah, yes, I got it. Okay. 27. A 43-year-old patient comes into the office with a red, swollen, and itchy eyes. She states she was at her friend's house over the weekend and the friend has three cats in her house. After examination, the physician diagnosed the patient with acute allergic conjunctivitis. So, what is the appropriate ICD code? Sonalika. Yeah. Kido 26. 26 is actually the correct answer. Sonalika correct answer dear 26D. Hmm. Akash, just check the code H10 H10.013 and H1. Check the code there. Mhm. 6 the code. Okay, guys. Akash, what about the second code H1013? Okay, right side. Actually, yeah. No, dear, actually. Yes. Okay. Itchy eyes. That's enough. That's all. A friend has. Okay. 27. Actually, this question option B is the correct answer here. H10.13. Okay. So yeah, let me explain the code. H10.13. The code explains the acute atopic conjunctivitis bilateral. It means here also some allergic conjunctivitis is mentioned in our question, right? The patient had some allergic conjunctivitis was mentioned. In our option, B is the correct answer, H10.13, because that is for acute atopic conjunctivitis bilateral. That indicates the inflammation of eye. I mean, some allergic conditions or some any kind of disturbance, allergic conditions, you have to code. Actually, for some redness in the eye or itching or any tearing, allergic trigger, any of them you notice it in your documentation, you have to take the code H10.13. Okay. Acute atopic conjunctivitis means it is related to eyes, irritation, itching, tearing, redness. Okay. Allergic condition. Option B is the correct answer. Okay. Anjali, correct answer. Yeah, B is the correct answer, dear. Gauri, correct answer. Everyone got it? 28 actually, Stacy, who is a patient who smokes one pack of cigarettes a day for the past 30 years, comes in today and is diagnosed with a gingivitis. So, what are the appropriate codes? Very good, Mohini. Correct answer. Dear C is the correct answer. Yeah, Akash, correct answer. C. Let's check 29th one. A patient is admitted with an acute myocardial infarction of the inferior wall after suffering an acute myocardial infarction of the left anterior descending coronary artery 2 weeks ago. Uh, yeah, what is the appropriate ICD code? Actually, yeah, 28th one correct answer, dear. 28th C is the correct answer. Twenty-eight. Actually 29 answer. What is the answer for 29? Pramod, just check the code. Yeah, Mohini, correct answer. D is the answer. This question's answer D. Very good, Mohini. Twenty-nine. Actually, here also D is the answer. So I 22.1. Let us check the code. I 22.1. I 22.1 code it is for a. The code it is for. subsequent myocardial infarction of the inferior wall. Here also, they have mentioned myocardial infarction, right? In the inferior wall. That is the diagnosis. Patient is admitted with the acute myocardial infarction of the inferior wall, right? So I-22.1 is the correct answer. And what about the second code? I-21.0. I-21.02 code is for elevation, like myocardial, STEMI related. Myocardial infarction involving left anterior descending coronary artery. Left anterior descending coronary artery is also mentioned in our question. Uh, Patient is, first of all, patient is admitted with the acute myocardial infarction of the inferior wall. That is the code I-22.1. And here also they have mentioned again acute myocardial infarction of the left anterior descending coronary artery. The code is for I-21.02. Simple. D is the correct answer. 3 correct answer. Everyone got it? Check the code carefully, guys. Okay, read the entire code. Yeah, 13th one is a patient sees her oncologist for metastatic liver cancer spread from the breast. Today, the treatment is directed at the liver cancer. So, what are the appropriate ICD-10-CM code? Thirteen D correct answer, dear. Very good. Kidu so fast. Devi Shri correct answer, dear. Others just check also. Okay. So, yeah, Mohini Pramod correct answer. Okay. 31. 31A, very good. Geetu, correct answer, dear. Is the right answer. Devishri, 31A, very good, dear. Anjali, check the code, dear. Just check the code, guys. Akash, correct answer, dear. C is the correct answer. Anjali also correct. 32. What about the answer 32? 32A is the answer. Correct answer A. Very good. Mohini and Geetu, Devi, correct answer, guys. 32A, C 91.00 comma. Uh, sorry, Q 54.182. Yeah. Soul also 33 also, guys. Very good, Akash. Okay, what about 33? A baby is admitted to the hospital. Mahesh, correct answer. Anjali, correct answer, dear. A baby is admitted to the hospital after being born in the car on the way to the hospital. What are the appropriate ICD-10 code? 33 actually. What is the answer for 33? Anjali, just check the code, dear. Yeah, B is the correct answer. Mohini, correct answer, dear. Anjali, check the code, dear. A is actually wrong. 33B is the correct answer. Mahesh, check the code. 33B is the correct answer. About 34. Gido 33B correct answer, dear. Thirty-two A correct answer, Sonalika. Devishri. What about dear 34C correct answer? 34C, that is for infant is up to 20 days age. It says 3 weeks, hence we coded C. Okay. Mm, C, 34C is the correct answer. Mohini, correct answer. Sonalika, yeah, 32 correct answer. Devishri, correct answer. Rasna, also correct, 32 correct answer. Mahesh, correct answer. C, correct answer. 35. A patient with a bilateral upper lid psychiatrical laparothalmosis treatment for operating valvate evidence. Promote C correct answer. Is the correct? Anjali, 34th C, correct answer. D, 35D, very good, dear, very good. D is the correct answer, very good. Nice job. Correct, Devishri, correct answer, dear. 35D, correct answer, Gidu. Correct answer, Mahesh. Thirty-six. Patient is seen for fever, swelling, and drainage from the right ear. He is diagnosed with mastoiditis. Mastoiditis. So, what is the